I was having such a problem, even walking, lower back pain, problems with climbing stairs,
Yeah.
and that was a real problem for me, and
Yeah.
it just wasn't going away. It wasn't getting better on its own.
Right.
So,
Then you also started having some referral down the leg, if I remember correctly.
yeah, numbness
Mm-hmm.
through the leg, and it was uncomfortable at at best, but it was something I was getting concerned about because I was getting, I wasn't getting better.
Yeah.
So, and things were progressively getting worse, going from having a hard time standing up to not being able to move around so much to not even
Going upstairs.
wanting to walk.
Mm-hmm.
Like exercise at lunchtime. I go for a walk and don't feel like it.
Yeah, sure. And then was it, I think, 3 or 4 weeks in, but then you were able to go out on a weekend and you had your how many, what was the flights? How many was the steps?
58 floors.
58
of
floors of stairs.
in one day.
In one day.
That was the equivalent of all the hill climbing I was doing while I was walking.
Yeah.
I was out in the outdoors, and I was trying to keep up with my friends that I were with, and not only did I break an all-time record for steps, but I was in awe. The fact that I was able to do that much walking and up hills like that too. Not
It wasn't like a little coaster thing. It was pretty steep and intense.
Yeah, absolutely.
And it's not
unbelievable that I was able to do that, like in such a short period of time too, because I was having some difficulty, and yeah, I did notice right away that the pressure and the relief that was provided, like the pressure that was removed, I should say, even though it was short term, with each adjustment, it was noticeable.
Yeah.
And that's where I started noticing I was gradually getting my mobility back.
Yeah. And now with your partner, you're walking how often?
Oh, I walk every day.
Awesome.
Every weekend, I'm posting easily. I have a Fitbit that I use for 10,000 steps is my goal, which is an average.
Right.
And I'm usually on a weekend, which is usually a day off for most people. I'm posting 22,000 steps.
Awesome.
Every day on the weekend, just doing yard work or getting up and doing around the house, or going out. Going to play softball tonight. I'll easily hit 12,000 steps. So,
awesome.
So
getting back to physical activity and playing and doing all the stuff you want to do, and not even thinking about any limitation.
Absolutely. If anything, I'm starting to find that I'm having some muscular aches and pains only because I'm able to push myself now, which is great. And, it is unbelievable for the simple reason that I know 6 months ago I wasn't in a good place, and with the treatment, it's really made the difference.
And we're at what? This is week number 7 now for us.
Okay.
This is week number 7. We did the progress exam last week. I just couldn't do the video, but we were. But that's what I remember. It was around week number 3 or 4 was when we ended up, when you were able to go out and do that major trek through the woods while you're turkey hunting.
Yes.
And then now here we are, another 3 more weeks. We did the progress exam, and you're telling me about the 22,000 steps. So, and then my phone's updated now, so now I can record it.
Yeah,
that's awesome.
I'm really happy with the progress. The treatments. I've had chiropractic treatments in the past, and I've had really good experiences with the right chiropractors. I haven't necessarily always had the same results with the treatments, but I can honestly say with the treatments that you're providing, fantastic, excellent results.
Awesome.
The proof is in the pudding. Quite literally, I couldn't move. Now I can.
Yeah,
so.
That's awesome. That's great, and it's just a matter of just as a clarification, it's as you said, it's just the right mix, in terms of that, because I mean, different chiros have different strong suits, and so it's just not that we're any better, or just we're different. And our approach in terms of focusing on the alignment of the spine and focusing on correcting the underlying cause of the issue and dealing with that rather than just your symptoms. The symptoms take care of themselves as we take care of what's causing the pain. Does that make sense? Sort of like, I can wave away the smoke, But if I don't put out the fire, the smoke alarm's going to keep going.
That makes sense.
So if I'm going to take care of the fire, then eventually the smoke will take care of itself. Do you know what I mean? And that's kind of how I look at it, that we're offering that long-term solution, that's offering that permanent solution to that spinal degeneration. And that's the approach that we have compared to the others. And there's other people who do it as well, but that's just our approach that we do.
Yeah, it's between the first session where you gave us the
report
information,
yeah,
and the background, everything made sense, like
yeah.
you said, and it was something to look forward to because once after you give us our individual information based on what you see in the X-rays, and
yeah.
There's a lot of unknowns there up until that point, and even then you're still not sure about how the treatments are gonna
how they're gonna go.
What sort of results you're gonna get, really.
Yeah, exactly.
So end of the day, the results are there,
yeah.
and that's me being able to get up, get moving, keep moving, and that really has been
got your life back.
Absolutely
Awesome.
able to move.
Thank you.